So how does this work? Let's talk about the perspective from the physician. If we identify a problem and we're able to say, hey, this patient is ApoE4 homozygous and they're high risk for Alzheimer's and they're having some cognitive impairment, cost of drug therapy is like $85,000 to $88,000. What about if we put them in a lifestyle coaching program? What about if, as we're doing this and we realize, hey, this patient is on opiates and there's a high risk with opiates with cardiovascular disease. Most people don't even realize it, but opiates stop the production of hormones and they also affect the heart negatively. Maybe that patient needs a Holter. Maybe that patient needs additional monitoring, and it can be remote patient monitoring that's fed back through an outside loop. That revenue goes to the physicians. Maybe this patient needs a workup. Maybe we need to take a look at their ABI index. Maybe we need to better understand why they have cognitive issues. Maybe we need to figure out how do we reduce their fall? How do we get rid of the restraints? How do we make the facility a better place? All of these things have tangible bill items that go through a separate part of Medicare and Medicaid, then does housing, then does the skilled nursing facility or the assisted living. So the goal is to maximize the revenue and make it concordant for the physician to work with CareGuard. We don't want to alienate the physician. We want them to find that there's tremendous benefit in what we're doing for them and helping them get to better care of their patients. And at the same time, improve the outcome of the patient. And especially when we get into the dementia and the deprescribing sections, that's where we really shine. Because sometimes there's issues going on that are sundowning, and it's because of the medications the patient's on. Or there's issues that pain is out of control, and you find out that somebody's been substituting Aunt Judy's Xanax with Tylenol. Or maybe you find out that somebody's been removing the narcotics, or maybe you find out why are those blood sugars so out of control, and it turns out that somebody's giving the patients candy because it makes them happier, and candy may not be the right solution, especially in a dementia ward. So these are all things that are easily identifiable during our CareGuard 360 examination of the facility and the patient. These are some of the bullet points that we look for.